are in listen-only mode.
Hello, my name is Erica Burrows-Girardi, and I am a community coach with County Health Rankings and Roadmaps. Welcome to our webinar today entitled Advancing Health Equity Through Strategic Partnerships. Today I'm joined by my colleague, Mary Bennett. Hi, Mary.
Hello, everyone. So happy you're able to join us today.
As we go through the presentation, Mary will be sending out links via the chat box, and we will take turns answering your questions. Now I would just like to take a second to briefly introduce our wonderful guest from Jefferson County Health Action Partnership, which is in Alabama, Katie Peters.
Hi everyone, happy to be here today.
Greg Townsend.
Hello everyone, glad to be here. I'm glad you're here too.
And Dr. Monica Baskin.
Good afternoon everyone, looking forward to it.
Thanks. We'll hear more from our guests later, but right now just want to say a hearty welcome to the three of you. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is a result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Next, we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you will see the viewer window where you can see our screen throughout the presentation, and on the right, you will see the control panel. Now here you can find handouts for today's session, including a PDF of slides and our guest bios. You can also interact with us through the control panel by using the question section. Please feel free to share your questions or your thoughts and experiences with us via the control panel using that questions box throughout the webinar today. And we'll be sure to leave time for your questions. Our partner, the Robert Wood Johnson Foundation, has laid out a powerful vision for building a culture of health in every community in the country. And that vision includes the belief that all individuals and families should have the means and opportunity to make choices that lead to healthy lifestyles, regardless of where they live. In other words, building a culture of health requires everyone in a community, especially those most affected by poor health outcomes, to have equal opportunity to enjoy good health. In essence, what we're saying is that to build a culture of health, we must achieve health equity. But what exactly is health equity? Let's make sure we have a shared understanding of health equity before moving forward. Health equity means the attainment of the highest level of health for all people. Healthy People 2020 states, achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. It's important to note that inequities that we see existing in health today did not happen by chance. For the most part, they are a result of policies that created opportunities for some, but not for all. So I want to present two examples of policies that have led to current inequities. Let's start with housing. Access to affordable housing is key to good health. Generations ago, during President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing. But they funded programs that allowed whites to move into new suburbs like Levittown, New York, while the options for people of color were public housing apartments in the same city centers where they already lived. Over the decades, the suburban homes greatly increased in value, creating wealth that passed down through generations of the white families that were living there. But meanwhile, even though laws have changed allowing people of color to have the right to buy into places like Levittown, many of these houses are now selling for $500,000 or more, which is out of the range for most people. For my second example, we'll explore the wage gap between men and women. With a history of women being excluded in the workplace, and women's jobs being differently valued than men's, there's a long-standing income disparity between men and women. This image from 2012 shows women earning just 77 cents for every dollar men earn. And as of 2015, women were still only making 79 cents for every dollar men earn. And this gap has had significant impact on families. Health equity seeks to redress these inequalities by, again, ensuring that everyone has equal opportunity to the choices that will allow them to attain the highest level of health possible. As you reflect on your work and listen to our guests, we invite you to consider today's guiding question. What steps can you take to improve health equity in your community? I want to share an image with you that kind of sets the table for what we're doing this afternoon. County Health Rankings and Roadmaps is rooted in the theory that health is the sum of many parts. Some of you may have seen this image, but for others it might be a little new. This image shows our approach to health and the foundation of County Health Rankings and Roadmaps. Policies and programs can and actually do influence health factors, which in turn impact health outcomes and multiple factors that impact how long and how well we live. Things like how we commute to work, access to parks, the quality of our schools, access to care, and diet and exercise are just some of the factors that influence our health outcomes. Take a look at this model and think about where you see yourself fitting into this picture. What are those health factors that you are addressing? Now I'm showing an image of our Take Action cycle. It shows that in order to address health effectively, multiple stakeholders have to be included in the conversation. You'll also notice action steps around the cycle that start from the right at assessing needs and resources and span to evaluation. Work together and communicate encompass the entire cycle because those action steps occur concurrently as you're completing the others. When on our website, you will notice that the action cycle is interactive. So this is where you will access the hundreds of practical tools and resources that will support you in moving forward in your work. Now, Mary's been chatting out some chat links to you. I also want you to know that we are preparing a handout for you that has all of these chat links in them, and they will be available on our website along with an archive of today's recording. So with that brief introduction to County Health Rankings and Roadmaps, I would like to introduce you to today's guest. Katie Peters currently serves as the Vice President of Community Impact for Health at United Way of Central Alabama. Based in Birmingham, United Way of Central Alabama serves a 5-county footprint and works to increase the organized capacity of people to care for one another and to improve their communities. The organization supports over 80 partner agencies, initiatives, and programs. Katie is also responsible for the management of the Jefferson and Walker County Health Action Partnerships. Greg Townsend is a health service administrator at the Jefferson County Department of Health in Birmingham. Greg has been employed with the agency for 22 years and works on special projects in the Quality Improvement Decision Support Division. Greg is a participant in the Robert Wood Johnson Foundation Culture of Health Leaders Program. This is a 3-year fellowship. This 3-year fellowship provides cross-sector leadership development based on evidence-informed experience and grounded in principles of equity and social justice. Greg was a 2016 fellow in Human Impact Partners' inaugural Public Health Equity Cohort. And Dr. Monica Baskin is a professor of preventive medicine and vice chair for culture and diversity in the Department of Medicine at the UAB School of Medicine. Dr. Baskin is the leader of the Jefferson County Collaborative for Health Equity, which is a diverse group of thought leaders representing academia, public health, local government, community, and faith-based organizations who are all committed to advancing health equity in Jefferson County. This group serves as the anchor organization for the Advancing Health Equity Priority Group of the Jefferson County Health Action Partnership that we will be hearing about in today's webinar. So with that, let's get started with hearing a little bit more about the Health Action Partnership. And Katie, I want to start with you. Can you tell me a little bit more about the Jefferson County Health Action Partnership? And you guys are going to hear me call it HAP for short, because that's a mouthful to say. So tell us a little bit about the Jefferson County HAP.
Sure, and thank you so much for asking us to participate in the webinar today. The Jefferson County Health Action Partnership is our local collective impact movement to improve community health, and our vision is that Jefferson County is a healthy, thriving, and connected community. The Health Action Partnership focuses on alignment, shared data, and a shared criteria for success. We work to address disparities in health in our region while seeking greater collaboration through specialized priority groups. And we look at sustainable results for the long-term improvement of practices and outcomes. The partnership is a long-term effort to improve health outcomes, and it's geographically based to meet needs specific to our community and population. It's sustained by what we call anchor organizations that commit staff time to ongoing administration of the partnership. Those anchor organizations are United Way of Central Alabama, the Community Foundation of Greater Birmingham, and the Jefferson County Department of Health. The partnership works to identify priority metrics and align our work with invested organizations that have complementary missions. And in the past, we've been able to leverage more than $13 million that directly supports member organizations and have become a regional model for collaboration. Because of our long-standing partnership, we're really poised to mobilize quickly if opportunities come up that will advance our work and support one another.
Great. And so tell us a little bit about the structure that you guys have set up and how it has enabled you to advance health equity.
Sure. Well, the Jefferson County Health Action Partnership currently has over 80 agencies involved and working in one of our 5 priority groups. Those priority groups are advancing health equity, optimizing healthcare access, improving mental health, improving the built environment, transportation, and safety, and promoting healthy lifestyles. And each of these priority groups has a shared leadership model with what we call backbone organizations that provide staff time and drive the agendas to improve metrics. So today our presentation will be focusing on the Advancing Health Equity Priority Group, which Dr. Baskin and Greg co-chair. And the work of the Advancing Health Equity Group aligns with each of their respective organizational missions, and their expertise in this field really drives the work.
Nice setup. Now, one thing that we always hear from communities is, how do you measure health equity? And I know that you guys have actually set up, you've set up almost like metrics to be able to track the advancements of health equity in Jefferson County. Can you share a little bit more about that?
Sure, and I'm going to talk a little bit about each of our priority groups as well. They all have a set work plan and metrics that are tracked annually. We call those priority metrics, and we use those to measure our progress, and they come directly from the County Health Rankings data set. So some of our current partnership strategies include working to pass, implement, and monitor complete streets policies to improve physical activity rates, working to support the availability of healthy after-school and summer meals for children. We work to improve mental health services in school-based settings, expand primary care availability and prevention efforts, and we assist with the prioritization of infrastructure investments within the city of Birmingham based on health equity considerations. So a way that we've been able to do that is that the Advancing Health Equity Priority Group worked to assist with that prioritization by creating a health equity index map that's included in this slide. The green map represents Jefferson County, and the Health Equity Index was created to identify the severity of health disparities for census tracts across our area. The index demonstrates the link between economic vitality and overall community health, and it's designed to be a tool to make data-driven decisions and improve health equity throughout Jefferson County. The index scores are assigned to each census tract based on 3 factors. Those are the poverty rate, life expectancy, and infant mortality rate. So these factors are combined into a scale that ranks the disparities from very low to very high, with the darker green areas representing the areas of greatest disparity. So because there isn't one specific measure of health equity in the county health rankings, we focused on measuring the effectiveness of our educational and organizational change efforts. We work to engage members of our community in gaining a better understanding of health equity principles and offering to work with organizations to assess their current equity efforts and design a plan of improvement.
Great. So in addition to that, that index that you've created does allow you to at least see where the greater areas of need are and where the people who have
Absolutely.
the poorest health outcomes are located.
Yes.
Great. Awesome. So you guys have done so much. I know we could actually do another webinar for you to talk about just your accomplishments, but I did ask you to highlight some of your recent accomplishments for our audience. Would you please share those?
Sure, and there are a couple of images on your screen right now related to some of these accomplishments. The first would be passing comprehensive smoke-free policies in 7 municipalities in Jefferson County. That covers over 300,000 people with comprehensive smoke-free policies. We're also working to complete or fully fund over 41 miles of street-based and greenway trails. So those are already funded and ready to be implemented in Jefferson County. And then the third would be passing stronger child safety, nutrition, and physical activity standards for child care centers. That covered more than 17,000 children in Jefferson County that were previously in unregulated and uninspected child care centers. And actually Alabama is working on a statewide policy right now to eliminate that exception throughout the state.
Good. And I do want to take this moment to emphasize that one of the best ways to address health equity is through policy. And yes, you guys are doing that with the policy and the environmental changes and system changes. That's where you really get at the heart of advancing health equity. So, Greg, I kind of want to bring your voice into the room at this point. And tell me, how did health equity become the cornerstone of the work that the Jefferson County HAP is doing?
Okay, Erica. Well, we believe that advancing health equity provides the best opportunity to improve health and mitigate health disparities. Over the past several years, there has been an increased discussion about health disparities, but I believe the combination of two key developments that occurred around the same time helped to catapult health equity as a cornerstone of HAP's work.
Okay.
First, in the fall of 2013, the Jefferson County Place Matters team, now the Jefferson County Collaborative for Health Equity, with the support of the Joint Center for Political and Economic Studies, released a community health equity report. The report was titled Place Matters for Health in Jefferson County, Alabama, the status of health equity on the 50th anniversary of the Civil Rights Movement in Birmingham. So this report provided a comprehensive analysis of the range of social, economic, and environmental conditions in Jefferson County and documents the relationship to health status of the county residents. Our strategy was to focus on the historical and structural and institutional factors that contribute to health and health disparities today. So by using a combination of text, graphs, tables, maps, and the report highlighted differences in health promotion environments and health outcomes such that there was an overall pattern of clustering of social and economic distress in low-income and non-white neighborhoods that seem to have created the conditions preventing people in those communities from living healthy lives.
So that report really did show that where you live matters to your health.
Yes, that report was truly a cornerstone for our movement for advancing health equity. And Erica, the other event took place in 2014 when the Jefferson County Department of Health embarked on its second community health assessment, its CHR. This document informed its new community health improvement plan, our CHIP. Survey and focus group data was collected from a variety of stakeholders across the county to identify areas to improve the health of all who live, learn, work, and play in Jefferson County. These things, beyond health care, were repeatedly mentioned across stakeholder groups and included issues related to built environment, education, poverty, housing, and other social determinants of health. Further, when participants were asked to rank priorities, efforts to reduce health disparities related to race, ethnicity, and economic status were at the top.
Mm.
And furthermore, in December 2015, the Health Action Partnership adopted our strategic issues, the strategic issues that we identified from the CHIP as the priority areas, subsequently agreeing that advancing health equity will be the foundation for informing the work of the other priority groups.
Yeah, that's great. I mean, what I really like hearing what you said, Greg, is three things. Well, first, that this is grounded in data. Okay, so this is not pie in the sky. This is not what we think. It is grounded in
Absolutely.
data. Two, you has your CHA and your CHIP to help inform that. And three, you as a Jefferson County Health Action Partnership members, you guys aligned your work with what you saw happening in the CHIP and the CHA. And folks who are listening to this webinar, this is great. We always ask people to do that. We got to find that alignment so everyone is on the same page.
Erica, not only that, we involved the entire community in the
Great.
process.
Yeah,
You know, it just wasn't us having a top-down approach. We wanted to make sure that we heard the voice of people in our community,
right.
the voices of people in our community.
Using both quantitative and qualitative data to do that. That's great.
Absolutely.
Yeah. Yeah. So, Dr. Baskin, you guys have done so much again, but I really am so intrigued by what you have been able to manage with advancing health equity there in Jefferson County. What do you think has been the key to all of this, to being able to have such success with the Health Action Partnership?
Yeah, so I think first, we have really been able to develop a very strong local coalition. So while this group represents diverse organization types, constituencies, interests, and personal beliefs, our partnership focuses on a shared value that everyone deserves to have a fair opportunity to live a long and healthy life. So because we use that local data to prioritize our action, we have found a number of local organizations willing to offer their time, talents, and resources to see improvement where they and the people they serve live, work, play, worship, and/or go to school. And also, by aligning our activities with the missions of these diverse organizations, we have been able to take limited funding and an abundance of sweat equity to grow and sustain our work. So having a very clear and clear objectives and realistic ones, we've been able to also go back and reassess what we're doing, and it's been essential to our success.
Yeah, starting with establishing that common value, that everyone has a fair opportunity to live a long and healthy life. That has to be the thread that you start with to pull everything together.
Absolutely.
So, yeah, so tell us about these guiding principles that came from those values.
Yeah, so having a very diverse constituency and a coalition, we thought that the very first thing we needed to do to be effective is to basically set a set of practical strategies for advancing our work. So what we did was develop a guiding principles document to help ensure that we were using best practices ourselves in promoting a healthy community for all. And so these principles include, first of all, involving those that are negatively impacted by poor health outcomes and environments in all parts of our work, so we could continue to have the voices at the table to guide us. Second, we focused on aligning our work in areas of demonstrated need. So again, being data-driven, finding out where those disparities are, and making sure that our time and efforts were spent where they were most needed. The third principle relates to having very clear and tailored messages for our audience, and then widely disseminating those messages out. Fourth, we focus on identifying and engaging community expertise. So we recognize that we don't always have to have the technical or scholarly experts, if you will, but oftentimes there are leaders within the community that know much more about the problem and its potential solutions, and so we make sure that those individuals are also at the table and part of our decision making. The next principle really relates to making sure that we're building community capacity to act. So while we hope that the Health Action Partnership will be strong and lasting for years and years to come, we also want to make sure that when we may not be attending to that particular community, that there is capacity that's still left there to sustain the work. And then our final principle is one where, we are always seeking and trying to take advantage of opportunities as they come up to really promote and advance health equity. So our Advancing Health Equity, as mentioned before, our priority group is really the foundational layer for the overall partnership. So we provide that training and capacity building both within our partnership as well as across the community. So for example, all members of the partnership are offered an Advancing Health Equity orientation, which defines what we mean by health equity, again having that common language. It also describes the unique disparities that exist within our county. So Katie showed or described the map before, where we were able to really hone in on where we find the disparities throughout the county. And then we also include in that orientation a discussion around the social and economic reasons why we would want to advance health equity. In addition, we provide the guiding principles document, which includes examples on how to implement these principles. It includes a glossary of common terms and a resource list. So we also have that available online for others to take a look at.
And I will add to that, Dr. Baskin, that these guiding principles that you all have adopted are actually kind of aligns with our Take Action cycle, because you see that really being with the assessing needs and resources, you guys were that's a principle of yours, that you're going to serve those that are most in need, that you're going to start there as a starting point. And then you're choosing what the effective strategies and stuff that's going to work for everyone. And you're starting with your own partnership first, making sure that everyone is on the same page, and then you're communicating that. So I see those steps in my mind, like work together and communicate and assess and evaluate. You guys are doing that all, and you're starting with your partnership first. That's great.
Absolutely, absolutely.
Greg, tell me about the fact that you guys have had impact, and you have worked really, really hard to do that. So what I want to know, I think what our audience would probably want to know, is like, what would you guys consider success for the HAP to look like? What does that look like for you? And you might be on mute. I might have to remind you to unmute.
Well, Erica, we are really making progress towards advancing health equity in Jefferson County, Alabama. Unlike other priority groups in HAP that tracks metrics like the county health rankings and roadmaps, we measure our work and its effectiveness by the level of impact we're having in our partnership and the larger community. Our work seeks to ensure that everyone who works, lives, and learns, worships, and plays here has a fair opportunity to live a long and healthy life.
So tell me how you break that down a little bit.
Hey, it's becoming clearer. Essentially, we are planting the seeds for health equity. Our impact is measured in a number of ways, including the number of conversations that include health and health equity in decision-making or the assessment of priorities. We also look at the number of new partners to our work who find ways to align their mission with a health equity lens for advancing health equity. We look at the new collaborations to share data, technical assistance, and other resources to promote health equity. We have increased in the coordination and communication among diverse sectors with a shared vision. And we also look at how our partners are embedding concepts like our guiding principles into organizational policies, practices, and procedures. The ongoing development and implementation of community demonstration projects is a key to our work. And finally, we can visualize the scaling up of successful approaches to more community groups and organizations in our county.
Great, great. Again, you see this theme of making sure that organizations that are part of this work really have a good grasp of what health equity is and that they are able to adopt those principles. And again, another theme I'm seeing here is the policies, policies, and practices. That's
And
very, very
Erica,
core to health equity.
absolutely. It's been an inside-outside strategy
Mm-hmm.
approach that we're using. You know, as our organizations build the capacity internally, we're better able to serve our community externally.
Yeah, yeah. And the last thing that I'm seeing is the data piece and being able to collect data and share data with those who are involved in this work. Awesome.
Absolutely.
Awesome. Katie, practical steps is one of the things that I love to be able to share with people. So what I'm going to do is I have asked you to share some practical steps of how you guys have done this work because people are always looking for what's practical, what can I achieve, what can I do if I want to start this now. So I'm going to ask you to walk through this image that I have just projected.
Absolutely, and some of these things have been discussed with Dr. Baskin and Greg. We've talked about how we're moving health equity from a vision in our community to a reality, and we've made substantial progress in steps 1, 2, and 3. So health equity is understood, health equity is a shared vision, health equity is a factor in decision making, and those are ongoing actions. Those are ongoing steps. So we haven't finished one and we don't continue the work. We're still working on greater understanding and the shared vision, but achieving successful outcomes in steps 4 and 5 are the future actions that will really indicate we have incorporated health equity in all of our decision making. So we have to continue to work on incorporating those principles in our own institutions, as Greg just mentioned, and in our overall partnership. So we want to get to the point where health equity is included in all implementation, and step 5 would be health equity is included in all policies.
Yeah, just thread it throughout. So for our audience that are participating today, you're looking for practical steps. This is how you start. Start by making sure that health equity is understood, and then again, moving to that shared vision, decision making, implementation, and policy. Awesome. Now, you know, you and I, Katie, have talked before, and in this work that you guys have done over the years to take health equity from just a vision to a reality, I've heard that you guys actually experience some pushback. And one of the things that I really appreciate about the Health Action Partnership is that you pressed forward. You didn't let that stop you. But some of the things that I know that you have heard in the past is this what we really need to do, and why are we assessing this now? Tell me about, a little bit about that, and how did you press on despite hearing those types of questions?
Sure, and you mentioned that some of the areas of pushback, some of the things we might hear are, is this really needed, or why are we addressing this now? And we feel that those concerns can come from a general discomfort with the subject of health equity, and that's why one of our objectives is to increase the knowledge and really the comfort level with health equity language and concepts, so this is an easier conversation for our partners to engage in with one another. And images like this one on the slide or the short video we developed to promote a common language and understanding about health equity and its local consequences help to make those conversations easier. So we recognize that the level of readiness to engage in this work varies, and that's why we've developed a 2-step process with a very general 1-hour orientation followed by the option to participate in a more intensive 2-day equity, diversity, and inclusion training. We've also encountered some economic pushback regarding the allocation of resources to this effort as opposed to some of our other priority groups. So our strategy is again to provide as much information as possible and clearly state the economic benefits of health equity, the dollars that can be saved by incorporating health equity into policies and practices, and the increase in the quality of life.
And one of the reasons why I wanted you to share that story is because communities sometimes will shy away from, addressing health equity for those very same reasons. They're just not sure how to manage the pushback. So I appreciate what I appreciate you sharing that, and I want to encourage our listeners to think about the fact that this has to be a priority. It has to be a priority in the vision of your group, and you can't let that type of pushback to stop you. You have to find ways to manage it, and one ways that you all found to manage it is by doing better education to your partners involved. So. And then another way that you've been able to manage it, Dr. Baskin, is by your partnerships. And your partnerships, just leveraging these partnerships have been able to, has helped you move, advance health equity. So tell us a little bit about that.
Yes, so while a local focus has certainly been critical to our work, we've greatly benefited from linkages to national initiatives and networks and other resources. So these connections have included the National Place Matters Initiative, which is now called the Collaboratives for Health Equity, and it's located within the National Collaborative for Health Equity out of Washington, D.C., Common Health Action, also out of Washington, D.C., and 2 Robert Wood Johnson Foundation programs, both the County Health Rankings and Roadmaps, sponsoring this webinar, as well as the Culture of Health Leaders. As was mentioned earlier, we had substantial help from the National Place Matters Initiative in developing our local community health equity report, and where we combine those maps and data to highlight inequities. As Greg mentioned, this report really paved the way for our strong local coalition and helped individuals to see exactly where the problems are and also discuss some of the ways forward. Similarly, we have partnered with Common Health Action to train several of our local members to facilitate the Common Health Action's Equity, Diversity, and Inclusion training, which is that more in-depth training that Katie mentioned. And so because we have our local individuals trained, we will be able to put on trainings here within our community.
Good. Very good. So tell us about the benefits, other benefits, I should be saying, that you have gleaned from leveraging these partnerships.
Yeah, so these benefits have included technical assistance. So for example, we've gotten TA on various aspects of our work, including advocacy training, assets and needs assessments, how to effectively communicate with that very broad and diverse audience and how to tailor those messages, as well as evaluation, what metrics are really appropriate when you have something as broad as health equity. We've also had training, the training I mentioned earlier on equity, diversity, and inclusion, where we had Common Health Action come to our local team and provide training to to members of our leadership to make sure, again, as Greg mentioned, starting within, making sure we were all on the same page and we had that basis for which we could count on one another to champion this work. And then just the overall resources and networks. So our national partnerships offer us access to a cadre of colleagues who are doing very similar work across the country. It also has allowed us to tap into financial resources to implement some local projects, and it's offered some examples of what has worked as well as what has not worked in other areas so that we don't have to repeat the same mistakes and missteps all over again.
Right. Sometimes people don't like to talk about what doesn't work, but that can be just as informative as what does work. So never underestimate the power of partnerships, folks, and start with County Health Rankings and Roadmaps. We're one organization that will be able to link you to other partners, national partners, if you're interested in doing this work. So I want to encourage our audience to start populating your questions in the question box. We will be ready to answer your questions very soon, and I know our guests are eager to hear what you've been thinking about. You know, you guys have done a lot, Dr. Baskin, and I know that one webinar really doesn't give you guys justice, but I know that you're not finished yet. There's some next steps. There's some more stuff on the horizon for you guys, so why don't you tell me a little bit more about that?
Yeah, absolutely. So we're excited about our progress to date. We know we've done a lot, but we certainly have a lot more left to do. So one of the things that we're planning on now is rolling out an additional component of our HAP priority groups reporting so that they can actually document a number of the activities that they've been involved in that are directly related to advancing health equity, and particularly how they relate back to our guiding principles document. We also will be launching the local version of the Equity, Diversity, Inclusion training by early summer, and we're initially targeting, again, those anchor institutions that Katie mentioned that are part of our partnership, and then we will be marketing it more broadly throughout the county. And then after those initial equity, diversity, inclusion trainings, we want to begin quarterly meetings with all of the folks who have participated to continue the dialogue and also identify local strategies to advance health equity. So with some generous funding from the United Way of Central Alabama, we will be able to host these meetings for at least 2 years and also offer some seed funding for a few initiatives to be launched and implemented each year.
Excellent. Excellent. So one of the things that I did ask you to do is to share some advice with communities that are looking to do similar work, because people, we hear about the fact that we want to advance health equity. We all hear this, but again, people do struggle with how do we get started, and what can I expect, and so just share some advice with our communities that might be looking to do this.
Sure. We've learned quite a bit as we've been working together over the last several years. And one of the things that we've learned is that it's really important to be able to tell a compelling story about the importance of this work that appeals to both the head as well as the heart. So this could be a combination of data and stories, but recognizing that people may be more motivated by one of these things versus the other. And there are a number of resources that are available for being able to capture this local data and these stories, including resources like Community Commons, which is a source for data and tools to tell your story. There's data available free from the United States Census Bureau and or your local health department. So we greatly benefited with our partnership with the Jefferson County Department of Health to capture that information. It's also important for you and your partners to make sure you're talking about the same thing. So while you may not need to create a specific glossary of terms, it is important to have confidence that no matter which partner is going out and talking about the work, that you're using that common language and you have a shared vision of where you're going to go. The other thing that's important is to not feel like you need to do everything right away. Setting small goals that can be achieved with the resources available are really critical, and having just a few small wins can help you to really find things that will snowball going on from there. Another lesson has been, also making sure that you make time to revisit your goals and objectives on a regular basis. So things change. We know whether or not that's, financially or staff turnover or political climate. A lot of things can change over a series of time when you have longer term partnerships like ours. And so it's important every now and then to check back in and see if you're on the right track or if things need to be adjusted. And then lastly, I think the work that we're doing here is very tough. I think any of us would say that. So it's really important to make sure that you celebrate all of your successes, no matter how small. And these little small celebrations, in fact, or celebrating the small things, can actually serve to re-energize you and your team as you continue to lift the heavy load of advancing health equity.
Yeah, so thank you, Dr. Baskin. And Mary, I know, is chatting out a link to a webinar short about how to craft a quick and persuasive message, the 2793 rule, or the elevator message. And I think that's helpful when you're talking about being able to communicate your vision. Like, what is your vision and how can you communicate that succinctly so everyone is on the same page? Everybody is saying the same message no matter who they're talking to, and also telling that compelling story. We also, County Health Rankings and Roadmaps, also recently broadcasted a webinar about storytelling. And that is so valuable, being able to share your successes in storytelling, as also being able to tell people why it is that you do this type of work. So anyway, thank you, Jefferson County Health Action Partnership. Thank you so much for sharing. I do want to remind our audience about our guiding question about what steps can you take to improve health equity in your community. And I hope that having listened to this, you now have some practical steps of where you can begin with that. And also to help you, I do want to tell you about another resource, and that is community coaching. Mary and I are both community coaches with County Health Rankings and Roadmaps, and there are 11 of us all together, placed throughout the country, all the way from Portland, Oregon, to the East Coast, where I am in Florida. And we are here to help you support your work, to help support you in your effort to advance health equity. So if you ever want to reach out to get some support from a community coach, simply just click on the peach Get Help button that you see in this image, and that's on our website, and we'll have a community coach respond to you, generally within 24 to 48 hours. So at this point, I do want to pause and see what questions may have come in through our question box. I'm going to take a break right now, get a sip of water, and I'm going to ask Mary to come in and start letting us know what questions might have popped up.
Thanks, Erica, and thanks so much, Katie, Greg, and Dr. Baskin. Yes, we have quite a few questions here, and one, while much of this you've referred to, but can you talk more about the role, Greg, of health departments in building health equity in communities? You may have to unmute yourself.
I'm sorry. Surely I can. It takes an inside-outside approach for health departments to advance health equity in our communities. There may be community members and health departments that may be excited about what they've heard from this webinar and really want to move forward from taking it from this momentary excitement to creating a movement with the realization that it is difficult work moving forward. But it's great work, and the communities will benefit from this work if they all pull together. But it takes collaboration with the leaders in the community, the partners, creating genuine partnerships, and also involving community members in the process.
Great advice. Thank you so much. Here's just a question for you, Dr. Baskin, referring back to a previous slide. Could you remind everyone what the 3 measures that you used to create the county index? I think it was life expectancy and infant mortality rate, but asking what was the 3rd measure that you used to create your county's index?
I think that was that Katie maybe was talking about that earlier with the green slide.
Yes, I'm sorry. I think it was Katie. Sorry.
Sure. Oh, that's okay. The 3rd factor was the poverty rate.
Excellent. Thank you. That was a specific question that someone had. Also, could you talk about, you referred to them in your conversation about pushback, but what are other barriers that you experience doing this work? And can you talk a little bit about how you address them? Whoever wants to take on that question.
Sure, I can elaborate a little bit more on that. I think, the biggest one Katie mentioned about this idea of what's the importance or value of health equity, and I think that's probably one of our largest barriers. So in addition to the comments that Katie made around education, I think what was really critical for us is to have a non-threatening conversation about the negative impacts of inequities and how that impacts all of us. So I think that was really critical to have that conversation in a room where we avoided shaming and blaming. So oftentimes when you have these conversations, people come in already with their defenses up about why, what those root causes are of the inequities. And so I think we approached it initially by just sharing the data, sharing the information, and letting people see where it is. And then again, that head and heart piece. So sometimes for some individuals, it was about seeing the numbers, seeing the maps. For other people, it was about hearing the stories about how someone, depending on where they live, were at a greater disadvantage for some reason or another because they live in an area where there was high concentration of poverty or other kinds of things that were really difficult for them. The other barrier, just very quickly, I would say, has to do with funding these initiatives. So again, it's very difficult to sustain this work if you don't have resources. And part of what's been really successful for us are those anchor institutions that Katie mentioned before, the Health Department, United Way, and our Community Foundation, but also the smaller, the organizations that are actually running those priority groups, those backbone organizations. And so we find ways to write collaborative grant applications, and then we also find ways to incorporate our activities into the existing missions of those organizations, so we can leverage what those organizations are already doing so that we don't have to have necessarily extra funds to do the work.
Thank you. That was just, again, excellent advice.
Can I add one more thing to that?
Please, please.
Yes, we have to look at things from a historical context also. We cannot ignore historical racism, power. We cannot ignore power and privilege in our community. But again, I think what Monica said is very important. We don't want to guilt people. We want people around the table. It's better. We can get more done when more people come together and talk about these things than for us to guilt someone and they feel like they're not welcome, you know, in the conversation. But we cannot ignore things from a historical context and how these historical patterns have created the disparities that exist today.
Thank you, Greg. I think it is so much. It's really part of the education for all of us, isn't it, to really understand the degree of the impact of these historical factors. So thanks for adding that. And another question that's come in, and I think this one might be for you, Katie. What is the role of United Way, and how does health equity align with your goals? And maybe with that also, what advice do you have for others that are maybe work with United Way and want to do this work?
Sure. And as many people probably know, the United Ways vary in size and geographic locations all across the country, so it's not really a one-size-fits-all way to engage with United Way, but I will say that advancing health equity and some of the things that have been discussed in those guiding principles really aligns with our United Way mission to build capacity and care for one another in our community. And so advancing health equity is really a perfect fit with that, and it aligns with our efforts in 4 pillar areas, which are health, education, financial stability, and access to services. So here in Central Alabama, this United Way has a footprint of 5 counties in Central Alabama, and we have the capacity to really play the role of convener for bringing multiple organizations together. A lot of those organizations are long-standing partners with United Way of Central Alabama. So we have very effective ways to communicate with a lot of social service agencies in our area, convene a lot of people within those organizations to offer these resources to, and really get the message out about why it's important to address health equity and how it will improve their organizational work overall. So that's one of the main roles of United Way within our Health Action Partnership, and also just providing that ongoing sustained resources for staffing to keep the partnership up and running.
Thank you, Katie, and I think all of you have done such a fabulous job, and the structure of your coalition in terms of the importance of those partnerships. I'd like to also mention that a couple of people have asked to go back to particular slides, and so I want to encourage you can look at the handouts which have all the slides, and so you can see all the images, as well as there's a link to the images. So since we're a little bit tight on time, I'd like you to just refer to the slide set. So I think just one more question, and then I'll turn it back to Erica to wrap things up. And let's see. Maybe if one of you could talk about what strategies, and again, you did refer to this already in your kind of 5-step image that you had, but what strategies do you recommend to go beyond raising awareness and education, which y'all do so well, but to phase 2 intervention and implementation, so maybe some of the policy work? What strategies do you recommend? Who would like to take that question on?
Hey, I like to start, and I would love for my colleagues to chime in. I believe it starts internally within each individual and within each organization, an inside-outside approach. And also, I think each organization or entity has to be committed to ongoing learning, lifelong learning, in order for us to advance a health equity movement around the country.
Excellent.
So,
Yeah, go ahead. Other additions.
I was going to say, I'll just add on very, very quickly. I think the second phase after that initial 1-hour orientation and some of that discussion, that equity, diversity, inclusion training is also very key, so that there is this self-awareness and exploration of how our beliefs and biases, when they're institutionalized, how they become really systemic in terms of how they show up in terms of disparities that exist. And so that additional training is much more in depth, and it really focuses on, at the systems level, at the institution level, what are some things that are influencing our policies, our practices and procedures that are in fact creating more disparities and not bringing about equity. And we try to apply, encourage others to basically apply that equity lens when making those decisions. So I think that's the next step, is making sure that we are promoting the equity lens in all of our decision making, and it's not just the larger policies at the county-wide or the statewide. It's, as Greg was mentioning, it's also within our local organizations. What are things that we are doing that we might need to do differently when we think about equity?
Excellent, thank you. And Katie, do you want to add to that, or?
The only thing I'd like to add that I think is going to be helpful as we continue with that inside-outside strategy is some of the opportunities we're going to have to work with organizations to assess. I mentioned this earlier, but to assess their current health equity efforts and then work with them to kind of create a plan for improvement in incorporating health equity principles into practices and policies. So I think we're going to have some very concrete strategies that we can work with organizations on that are seeking to advance health equity.
Thank you. And again, just such great advice. I'm just getting lots of messages from people thanking you so much for all the excellent information and advice. And I think we just have a few more minutes. So Erica, I'll turn it back to you to wrap up and talk about after class.
Thank you. Thank you. We actually going to do a post-webinar conversation, and that's going to be related to the information that you just heard about, and that's going to be on May 2nd at 3 o'clock Eastern Time. And I want to invite all of you to participate on this conversation. Now, it's going to be different than a webinar. So with the webinar, you've been kind of listening to us. You didn't see our faces, but this is going to be totally different. This is actually going to be a face-to-face conversation that you can join in and dialogue with people right there at your computer, but with folks all over the country. All of you guys who have participated in today's webinar will be invited to attend, and it's going to be facilitated by Joanne Lee, who is who works at Active Living by Design, which is one of our national partners. And I really would love for you to consider attending this. Registration is limited because it is going to be a video conference. If you don't have a webcam, that's fine. You can still call in, but we do encourage that face-to-face interaction. Please do plan to attend that. And when you think about, these are the questions that we'd like for you to think about, rather, when you come to this conversation on May 2nd. So what are the opportunities to address health equity in your community? Where is there more work needed? And what are some options for addressing areas of need? So register. Mary's going to send out the registration link. You'll probably also receive an invitation. Be sure to determine whether or not you can participate through video conference, or maybe you have to call in, and just be prepared to discuss. So I'm hoping that you'll be able to participate on that on May 2nd. I want to encourage you to stay connected with us. We have a presence on social media, Facebook as well as Twitter, and sign up for our e-newsletter. That's the best way to find out about our upcoming webinars. I know in May we'll be doing a series on evaluation, so you might be interested in that. Make sure that you are receiving our e-newsletter for that. And lastly, I want you to think about these reflection questions as we wrap up. Who else do you need to share this information with? And what is one idea for action that you're taking from this webinar? And what it is that you need to do to make that action happen. And as I reflect on that last question, I'm reminded of the fact that April is Minority Health Month, and this year's theme is Bridging Health Equity Across Communities. This year's theme emphasizes the collaborative and community level work being done across the nation to help achieve health equity. So if your partnership is thinking about becoming more intentional about advancing health equity, why not start today? This is your opportunity to do that. And be sure to register for our May 2nd post-webinar discussion, so that way you can get some more tips about how to advance health equity. So with that, I want to thank our Health Action Partnership guest again. And I also want to thank my wonderful colleague, Mary, who is just awesome, and I enjoy partnering with you as always, Mary. Thank you for taking time out of your day to participate in this conversation, and we hope to see you next time with our webinars from County Health Rankings and Roadmaps. Thank you, everyone. Bye-bye.